Azara is one of the reasons that we agreed to do the Upstream partnership in the first place. It's actually a really powerful tool, particularly for smaller health centers, to be able to have that level of data reporting and extraction.
Azara is a population health data analytics software platform. We provide to our customers easy to use data analytics software so that they can assess all different types of metrics across their populations, from rates of screenings for colorectal cancer or breast cancer to assessing operational efficiencies at their different practices.
Upstream and Azara have been working closely together since 2017, and we have curated a specific module called the Upstream Family Planning module. It contains a suite of measures and metrics that really show a range of different dimensions of contraceptive service delivery. Azara Drives is able to show us in real time metrics that are important to driving practice change related to contraceptive care. We can look at what services are happening and being provided to patients at baseline, and we can watch how those things might change over time as technical assistance on the ground goes into effect and really gets implemented, and then how care teams are adopting new practices and workflows.
The data points that tend to surprise the teams are usually the ones around reproductive health screening. They often think that they're screening patients at a really high level. They're saying that we have these conversations all the time. They see the data and actually shows that it may be much lower, most likely because it's not in structured fields.
Dashboards are a really great tool to be able to visualize data in Drives. It allows for you to see all kinds of data points right in front of you, and it's accessible to leadership, providers, MA, really anyone in the health center who needs access to be able to see that data. And seeing that data will allow for them to identify where those gaps are and be able to make improvements as needed. And the great thing is that everyone at the health center can be involved in improving patient care.
They use the Azara data to have a dashboard that actually updates every 2 weeks so that you can give real-time feedback to clinicians and teams about whether they're doing the screening or not. And if they're doing the screening, who's doing what level of screening. And that's very easy to do with Azara. That wasn't any more work than connecting it to the EHR.
When you combine Azara Drives and Upstream training, you get more than just data. You get really powerful insights that are going to help you drive change and create sustainable impact with your patients.